Hello, everyone. It is wonderful to see you all. My name is Dr. David Roberts, and I'm Dean for External Education here at Harvard Medical School. It is my honor and privilege to be hosting this event today, and I would love to tell you just a little bit about it and the Office for External Education here at Harvard Medical School. In addition to thanking you for joining, I want to remind you that today's event will be recorded, and the slides and the recording will be shared with everyone, with all registered attendees. So Harvard Medical School has an Office for External Education, and our role is to bring amazing education and programs and materials to the world on topics in medicine, in medical sciences, and in health and wellness. And our Harvard Health Publishing arm is the part of external education that brings this information, particularly for people like all of you, patients, family members, concerned citizens, on health and wellness topics. So I'd love to tell you a little bit about our Lyme Wellness Initiative. This is a project which has been funded through a fantastically generous gift from the Fairbairn Philanthropic Fund. And the idea was to create educational materials that really raise awareness of Lyme disease amongst the general public worldwide and help all those who have Lyme disease and trying to improve people's quality of life. We started www.lyme.health.harvard.edu back in July of 2022. And I would encourage everyone to go to this website if you want to learn about the basics of Lyme disease, as well as having some very important information for those of you who are living with Lyme disease. Today, it is our pleasure to present the third in a series of webinars. And these are all part of the Lyme Wellness Initiative. And you can find the recordings of the first two webinars on our website. Those first two webinars covered first the topics of optimizing life with Lyme disease, and second, staying safe outdoors. Those are both, again, on our website, and I saw that my colleague has put the URL for that, the web link in the chat. Let me tell you just a little bit about today's great event. We are going to focus on how patient-centered innovation is accelerating progress with Lyme disease. And this will be a conversation with three colleagues from our government's Health and Human Services Department. I think it's really important that we recognize that despite nearly 500,000 people being impacted by Lyme disease every year, there still are many, many unanswered questions about the diagnosis, the treatment, and the potentially long-term impact of Lyme disease. Today's speakers are Drs. Kristen Honey and Daniel DeSautells, and Kathleen Carroll, who all work at the U.S. Department of Health and Human Services, where they are spearheading several patient-centered government initiatives to address these and other unanswered questions about Lyme disease. Now, the team today is going to describe the purpose and the progress of their projects and the impact that these initiatives can have for, again, people like you and for all people who are facing Lyme disease. After their presentation, I'm excited to ask them some questions that we've received about Lyme disease and their programs. And we won't be taking additional questions from you today, but I just want to remind you that we've really tried to hear your questions and incorporate those into the ones that we'll be asking today. It's now my pleasure to introduce to you Dr. Kristen Honey, who is going to introduce her co-presenters as well. Kristen is the Chief Data Scientist and Executive Director of Innovation X for the Office of Science and Medicine in the Office of the Assistant Secretary of Health at the U.S. Department of Health and Human Services. She is co-founder of the Lyme X Innovation Accelerator, which is a $25 million public and private partnership. She previously served as the inaugural vice chair of the Tick-Borne Disease Working Group, and she co-authored their important 2018 report to Congress on Lyme disease. Dr. Honey has a PhD in the Emmett Interdisciplinary Program in the Environment and Resources, and from the School of Earth Sciences at Stanford University. She also has a PhD minor in Civil and Environmental Engineering, and we are super excited to welcome you, Dr. Honey.
Thank you so much, Dr. Roberts, and for this invitation from Harvard to be here. Our HHS team is thrilled. And with that, let me introduce Dr. Daniel Desautel and Kathleen Carroll. You could turn cameras on and start our slideshow, please. While Daniel's pulling up the slide, Kathleen, why don't you self-introduce so the team knows how who you are? And we're going to be tag teaming. We're going to be doing a group presentation. So you'll hear from all three of us. Each person who is leading the portfolio will be presenting our work. So Kathleen, over to you.
Hi, everyone. Thanks, Kristen. My name is Kathleen Carroll. I am the lead designer for Innovation X in the Office of the Assistant Secretary for Health, and I'm also a U.S. Digital Core Fellow. And my role is leading the Human-Centered Innovation portfolio, which involves using human-centered design to listen and learn from people affected by health issues. And I'll pass to Daniel for his introduction.
Thank you, Kathleen. Hello, everyone. It's great to see everyone, and thank you for joining today. My name is Daniel Desautel. I am a fellow with Health and Human Services, working alongside Kristen and Kathleen on all of our Lyme, tick-borne disease, and vector-borne disease initiatives and portfolios, including the LymeX, which we're going to talk about today.
Great. Next slide, please. And we have a lot to cover in this next 50 minutes, and we're hoping to leave a good 15 minutes for questions. So the outline that I just want to quickly go through is people first, data always, putting humans at the center and first for everything we do. And then following the data wherever it leads. So going into data-driven Lyme innovation. Then we'll zoom out for the big picture of what's happening across all of the federal government, interagency with the vector-borne disease national strategy, and how different portfolios are now all aligning and advancing the goals set forward by the national strategy. And Daniel will walk us through the LymeX Innovation Accelerator, which includes or is part of the LymeX public-private partnership previously mentioned. And of that $25 million public-private partnership, $10 million is going to cash prizes for diagnostics, the next generation of improved Lyme diagnostics. Then we'll really return to the people with human-centered innovation, and Kathleen will close us out with interdisciplinary solutions together. Next slide, please. So who are we at HHS? We are a scrappy group of self-taught technologists, PhDs, and innovative interdisciplinary problem solvers. We sit in the HHS Office of the Assistant Secretary for Health, which is the office with the Surgeon General and the Commission Corps, and has the mission for public health across this 90,000 person department. Our Innovation X mission is to catalyze healthy futures for all through science and innovation. And we really are trying to build a healthier, more equitable nation using the power of open innovation. So crowdsourcing, citizen science, prizes, challenges, partnerships, and emerging technologies for exponential impact. Next slide, please. So how do we do that? We kind of have three broad areas. One is data, informatics, and digital innovation. A lot of that is fueled by open data. So you can look at data on healthdata.gov or data.gov, and that can fuel new ideas, accelerate scientific progress, and fuel all of our innovation activities. Another core area that's led by Kathleen is human-centered design and the patient experience, the customer experience, user-centered design. Often these involve putting the people who we serve at the center of the process, and then together co-creating solutions in short, fast-paced, agile sprints. So we make the solutions together. And then last but not least is the open innovation and really opening up the aperture in the solution space to engage all disciplines, all walks of life through crowdsourcing, community science, and grand prize challenges. Our office does not run programs. The one exception to that might be the KidneyX partnership that has $5 million a year from Congress. So that's a program, but most everything else we do, we are a catalyst and we get in and out, and success is working ourselves out of a job so that the momentum, the handoff happens to other parts of the department, whether it's to our friends in CDC who do disease prevention and control, or colleagues at NIH leading on federally funded science, or at FDA where they do the regulatory approvals for new diagnostics and treatments. So we work closely with other parts of the department, and they help us scale and implement, as well as working with external partners. And then we'll hand off the solutions for long-term operations. Next slide, please. We try to tackle what we call wicked problems. And some of you may know I'm from Maine, so people think it's just the lingo of, wicked good, wicked problems. But this is actually an academic term that comes out of 1970s social science literature and social planning. And wicked problems typically are extremely challenging. So they're not named wicked because they're evil, but because of their complexity and difficulty, and that no one discipline alone can solve them. And some of these challenges, these wicked problems, may not have solutions. However, we can work on them to move the needle and make the situation better. So wicked problems take many disciplines. Often you have to cut across silos and really think of creative new ways to move the needle that may not be completely solvable, but we can definitely make the situation and the environment better. Next slide, please. So the areas where we've been really focusing for Lyme disease, and I think everyone here would agree that Lyme disease is a wicked problem. One is the lived experience, and when, where, and how are people exposed to and become sick or die from Lyme disease. So really understanding it from the how the disease impacts society. A second area where there's a lot of open questions and science is very actively moving the needle is diagnosis. How can we improve methods and guidance to diagnose Lyme disease at all stages of the disease, from right after a tick bite to many years later? Lastly, or third, prevention. Everyone agrees that we need to improve the methods and guidance to prevent and control Lyme disease. That includes the public education and prevention. It includes clinician, practitioner education, prevention at all levels. Next, treatment. How can we develop and assess Lyme drugs and treatment strategies to really return people to full wellness, return everyone to full wellness? And then the last area where our Innovation X team probably works the most is on the real world impact and innovation, and really translating all the emerging scientific insights, new diagnostic technologies, and everything into real world impact. So that involves dissemination and implementation of public health tools, programs, and collaborations, partnerships for Lyme disease, and that's often in collaboration with all of you out there. Next slide, please. So beginning, people first, data always. Next slide. One tick bite can change your life. It can affect anyone. It can affect all of us. So this, this topic that affects almost 500,000 Americans a year by CDC estimates, 476,000. Next slide, please. Is very ubiquitous. It is the fastest growing vector-borne disease in the United States. It makes up over 70% of all vector-borne diseases in the US and over 80% of tick-borne diseases. There's about 20 tick-borne diseases that cause illness in humans that we know about, and we are discovering new diseases through time. So it's very, very common. Next slide, please. Lyme is insidious, and it disproportionately affects those who work and play outside. That often includes children, adolescents playing outside. It makes sense. Other vulnerable communities include agricultural workers, foresters, veterans, and service members who have done their training outside. Everyone is at risk, as I mentioned, and children is a huge motivator for our work that we do. Next slide, please. The full cost of Lyme disease is unknown. We know it's many billions draining from the economy every year, draining the US economy in direct medical cost. but there have yet to be full cost of illness that includes secondary costs, taking time off of work, driving to the doctor's appointments, missing that work, the gas expenses, the staying in a hotel if you have to stay out of state, or the tertiary costs. Sometimes loved ones have to take time off of their schedule and travel with you if people are too sick for Lyme. So all of those costs holistically have not yet been fully characterized. There are some preliminary estimates based on crowdsourced data from My Lyme Data that Lorraine Johnson and others have published that suggest it could be 25 to 75 billion every single year drained from the US economy. But we need more economists to really look at this and do a whole cost of illness assessment before we'll know for sure. Next slide, please. Now, I myself am a Lyme patient, and I am lucky to have recovered and be able to work well enough. But my story is so similar to so many of you out there, and I want to share it because these individual anecdotes, first of all, we're not alone. And second of all, it's what motivates us every single day inside the department to look at Lyme through a new lens and do better for these complex, multi-systemic, chronic conditions. So with Lyme disease, these pictures are from 2008, 2009, when I was really, really sick. But the outside world didn't see it because, next slide, please, I would crash behind closed doors and pay the piper from overdoing it. Many of you know these, this scenario where you look fine from the outside, but you look fine. You can't be sick. Your health waxes and wanes. So it's very isolating. You might have a good day, then have several bad days. And that's hard for the public, those who haven't lived it, to truly grasp. So a lot of our motivation is really on behalf of the individuals who cannot advocate and champion for themselves. In our office, we try to work for those who don't otherwise have a voice or an advocate. And often these invisible illnesses, the chronic conditions, are one of those areas. And so next slide, please. If you're out there really sick and too sick to be your own champion or advocate, or if you're a caregiver really caring for someone and that's a full-time job, let me please assure you there is hope. There is recovery. Everyone is different. And so there's no one size fits all. And the number one thing you can do right now to help the whole movement is to heal yourself and heal your loved ones. And what I have on this slide came to me when I was at my sickest and really bedridden. And it took me, it was 10 years of misdiagnosis and then 6 months to figure out what was really disabling me. And then about 2.5 years of nothing but full-time healing. So 3 years of nothing but full-time healing before I could return to work. This mantra came to me at my sickest. And for the first year of my healing, all I could do was the first line: rest, breathe, sleep, pray. Rest, breathe, sleep, pray. Rest, breathe, sleep, pray. Eventually, because of support from the community here, because of doctors who really invested in my wellness and helped me quarterback it through, I graduated to the second line of accept and surrender. And then from that, finally, in the third year, healing came. But it was a journey. And so don't in any way feel pressure I get from a lot of people. How can I help? How can I help? The number one way Lyme people can help is by putting on their own oxygen mask first, healing themselves. And by doing that, you're raising yourself, you're raising the vibration, you're lifting the whole community by showing with example that full recovery, a functional cure, as I think of it, is possible. Next slide, please. Now I'm going to transition the last two before I hand it over to Daniel. Next slide, please, is about the community-driven Lyme innovation. And I just want to thank Harvard here because before government was involved from the HHS headquarters side, there was a bottom-up community movement. There was a groundswell across the advocates, the caregivers, the patients, and everyone came together and said, this is a problem. Even if federal government is not leading the way, we can together find each other and let's co-create solutions. So the public on change.org and Obama's crowdsourcing platform, previously called We the People, put on petitions demanding that HHS and our federal government take action on Lyme disease and prioritize it. From that demand from the public, academic groups, and Harvard was one of the early adopters, as well as Stanford University, Berkeley, Johns Hopkins, Columbia, MIT Hacking Medicine, they all came together and said, look, we can share our data, we can share our science, and we can create a safe space for patients and practitioners to work together on solutions. And they hosted, all these academic groups hosted a series of hackathons over almost 2 years. And then that was recognized by the White House in 2016. And from that recognition at the White House level, and with the American Association for the Advancement of Science, and getting some of this bottom-up hackathon solutions onto the main stage, next slide, please, we finally had the top-down engaged. So you all, beginning with Harvard and other academic groups, started this movement. And after 3 years of hard work that was built on the shoulder of giants for decades working, only in 2018 did HHS headquarters lean in and build upon all of the momentum that you all created. And then we've systematically unlocked resources, formed partnerships, including the world's biggest public-private partnership with a generous $25 million commitment from the Stephen and Alexander Cohen Foundation. But where true transformative and lasting change happens is when the bottom-up community that knows firsthand where the pain points are and knows firsthand how we can have the biggest bang for the buck and move the needle on this in a way that will make the most difference in people's lives today, when that bottom-up momentum meets top-down resources and top-down priorities, then together we can have lasting and meaningful change. And with that, I will pass it over to Daniel Desautel with the next slide, please.
Hello, everyone. My apologies for the technical difficulties there. I was unable to turn my video on, but I'm here now. Thank you, Kristen, for the introduction. Again, my name is Daniel Desautel, the LymeX Innovation Fellow with our team. And so I'm going to pivot to talking about two of our main initiatives, the Vector-Borne Disease National Strategy and the Lyme Innovation and LymeX Public-Private Partnership. And so to give some background here, Congress has also taken an interest in vector-borne disease. And at the end of 2019, they passed the Kay-Hagan-Tick Act, which was named after the late Senator Kay Hagan, who unfortunately passed away from complications of Powassan virus. And this act required the HHS secretary to develop an interagency national strategy with both civilian and defense departments to address the growing threat of vector-borne disease in the United States. And this was building upon the previously published National Public Health Framework from the CDC, which outlined a similar plan. And so our office, along with CDC, who is our other co-lead, have been developing this report over the last couple of years. And so in the end of 2022, we published a request for information on the Federal Register. So this could be viewed online in the link below, and this link will be included in the slides that will be available at the end of the talk. And so we were asking for everyone's feedback on the 5 main goals that we are outlining in this strategy. And so I'll walk through them very quickly here with you all, but essentially the first goal is we want to better understand when, where, and how people are exposed to and become sick or die from vector-borne disease. The second goal focuses more on developing tools and guidance for diagnosing and detecting vector-borne diseases. The third goal is about developing, evaluating, improving tools for the prevention and control of vector-borne diseases. The fourth goal really focuses on treatment strategies for vector-borne disease. And the fifth goal focuses on developing and implementing and disseminating all of those great products and tools and programs and collaborations that are included in the above first 4 goals. And so a lot of the work that we do on Lyme, other tick-borne diseases, and vector-borne disease really points to this strategy to address the growing threat of vector-borne disease and Lyme disease in the United States. And so the area that our office is specifically working on is the LymeX Innovation Accelerator, which I'll go through next. And essentially, this is the world's largest public-private partnership for addressing the growing threat of Lyme disease. And so back in 2020, HHS and the Stephen and Alexandra Cohen Foundation entered into this public-private partnership with the goal of using innovation and crowdsourcing and prize competitions and all the tools that Kristen talked about before to really move the needle on Lyme disease. And so there's 3 main focus areas that we have in the LymeX partnership. First is patient-centered innovation. So in this initiative, we are using human-centered design methods to really understand the patient and caregiver perspective and bring that into the work that we do. And my colleague Kathleen will talk a bit more about that after I'm done. The second area of focus is on education and awareness. As Kristen said before, we all agree that more education and awareness about Lyme disease and tick bites is very important. And here we use innovative methods to crowdsource new and cool like educational and awareness campaigns to really tap into all of the great information everyone has and share that around. And then lastly, we have the next generation diagnostics. And here we use prize challenges to really stimulate the market and try to get better Lyme diagnostics to market and improve so that it can benefit those who are dealing with Lyme disease. And so here's just kind of a summary of some of the things that we've been working on for the past couple of years. So for next generation diagnostics, we had a request for information where we asked the public about like what do we need to do to move the needle on creating better diagnostics, and we got dozens of responses there, and that information really helped us plan out the LymeX Diagnostics prize competition, which I will go over in a few slides, or the next slide actually. For education and awareness, we created a crowdsourcing community called LymeX Crowdicity, where people can come and share their ideas and bounce ideas off each other and improve ideas. Over almost 70,000 people have viewed those pages and over 60 ideas have been created. And then we had the LymeX Healthathon, where we crowdsourced education campaigns, and it was a 4-week sprint where people from all over the country came up with really cool solutions for education and awareness campaigns, submitted their solutions, and there were 5 winners, which can be viewed on our website. And then for patient-centered innovation, which Kathleen will talk about in a couple of slides, we have the Health Plus Lyme disease report, where there was almost 700 hours of interviews with Lyme patients, advocates, and other people in the field to really understand the lived experience of Lyme patients and what that means for the future areas of Lyme innovation and what we do. And we've also had some roundtables, co-creation workshops, and research workshops to really hear from the public and other partners on great ideas and what we need to do to move innovation forward. And so one area that I've really focused on since I've been with the team is the LymeX Diagnostics Prize Competition. And so the problem that the public had pointed out and we had realized is, so Lyme disease is the most common vector-borne disease in the United States, but there haven't been really any major breakthroughs in diagnostics in dozens of years, over 25 years. And we know that early diagnosis is key to treat people and make sure that they can live the best lives that they can. And so we really need some great diagnostics to accomplish this. And so there was an opportunity here where we could use our public-private partnership to spark innovation in the field and use a prize competition to call for submissions for innovative diagnostics and reward the best ones with cash prizes. And this is a $10 million multi-phase, multi-year competition to take those innovative solutions and accelerate them towards submission to the Food and Drug Administration for review, and hopefully those diagnostics can be used in the real world to benefit patients. And so a small timeline of what we're doing here in 2022, we launched phase 1, which was a phase where we were calling for concept papers and plans for development. And we had $1 million in prizes, where there were 10 winners who each had a $100,000 prize. Those 10 winners were invited to phase 2, which just recently concluded. And that was a development and prototyping incubator where teams had access to learning modules and subject matter experts and webinars to help refine and improve their diagnostics and get them further towards the FDA submission step. And then in some potential future phases that we could have are to really gear up for that FDA submission. And so here at this website here on our LymeX Diagnostics Prize website, you can check out some in-depth interviews with each team, all 10 teams, on the types of diagnostics they're coming up with and what they're excited about and why they chose to enter this competition. And so I really encourage everyone to check that out and learn about all the great stuff that they're doing. And with that, I will pass it off to my colleague Kathleen to talk more about human-centered design.
Thanks, Daniel, and thank you, Kristen, for that look into the community-centered innovation and scientific innovation addressing Lyme disease. Like Daniel said, today I'm going to be speaking about another one of our methods, human-centered design. Our human-centered design methodology is called Health Plus, and it's a set of tools that we use to listen and learn from patients and define solutions together. Next slide, please. As many of us know, Lyme is so much more than a temporary illness, and it can impact a person's life so far beyond just a tick bite. This quote comes from a participant in our Health Plus research. He notes that Lyme has impacted his ability to show up in his life as a father, a husband, and an employee. And our Health Plus research aims to gather qualitative data to understand and recognize the patient experience in ways that scientific literature cannot. Next slide, please. So like I said, the Health Plus model uses qualitative research like interviews, observations, and workshops with those affected by a certain health issue to determine and prioritize opportunity areas. This qualitative data, which is gathered by listening to and learning from those most affected by a health issue, acts as a complement to the breadth of scientific literature that exists for a health issue. And the output of a Health Plus cycle is a report with recommendations for government, private healthcare institutions, and the scientific research community. And each step of the design cycle is validated with the participants involved in the research. Next slide, please. We found that this model is most effective with complex multisystemic health issues, and we've applied it to Lyme disease, sickle cell disease, and most recently, COVID-19 and long COVID. And Lyme disease doesn't present as one specific set of symptoms. Each person may have a different set of experiences, and that impacts their lives in different ways. And because of this, it can be really hard for someone to identify that they have Lyme disease, get a diagnosis, and get treatment. So in 2021, we published the Health Plus Lyme disease report, which you'll be able to access in the chat. And this report acts as a complement to the growing body of scientific research surrounding Lyme. The report is based on over 700 hours of human-centered design research, interviews, and workshops with people who have first experience with Lyme, their advocates, and caregivers. Next slide. And based on that research, the report has a few design artifacts that are used to identify patterns and recognize the experiences of Lyme patients. So you'll see an example of one on your screen now. This artifact is called a patient journey. So by synthesizing the qualitative data, we're able to identify areas where Lyme patients have had similar experiences that could be improved. So this simplified graphic identifies a common journey that researchers observed in multiple different patients. And you can see that this journey has multiple areas where improvements could be implemented to get patients more accurate diagnoses, better care, and more support. The full patient journey is in the report, which is linked in the chat, and it demonstrates a variety of patient experiences, as well as the ideal patient journey, one where a patient is believed and supported by their healthcare providers, insurance providers, and wider community. Next slide. This impact matrix is another artifact based on the research in the Health Plus report. It demonstrates capacity, which refers to the physical and mental constraints that patients and caregivers face as a result of Lyme. And it also demonstrates disruption, which refers to the level of participation a patient has in their day-to-day life, from going to work or school, being a parent or a caretaker, and so on. The research from the report demonstrates that even those who are less disrupted and have more capacity are still impacted. Lyme is still an extremely impactful part of their lives. Next slide, please. And the final product of the Health Plus Lyme disease report is a series of 4 opportunity areas. The report features several recommendations for service improvements in these 4 areas that span across sectors. So for example, the first opportunity area is broader awareness of Lyme disease, which refers to both awareness for the public to protect yourself when you're going outdoors, but also for healthcare providers to be able to recognize and diagnose Lyme better. Next slide. And on June 28th, we held a Lyme Innovation Co-Creation workshop to align the community with recent updates and progress. And co-creation refers to a process of designing products or solutions that involve partners, all partners affected in every step of the way. And this event was centered around these 4 opportunity areas and determining if they still resonated with the community and aligned with the current priorities. And we found that an accelerated research or an accelerated diagnosis process was the highest priority, and one that the federal government and the innovation sector have the most impact potential, and one that we're currently working toward, which aligns with our current set of goals as an office as well. Next slide. And I'll conclude with a quote from our report that emphasizes the importance and the scale and impact of addressing Lyme. Lyme has the potential to impact everyone, regardless of who you are. If you're someone who goes outside, you are at risk. And so that really emphasizes the importance of addressing this issue to us. Next slide, please. And that's why patient experience with firsthand knowledge, your lived experience as a caregiver, it's equally important, if not more important, than the scientists, federal employees, and others working in this space. And vast quantities of data are lost when patients are disempowered or there are unequal partnerships in what should be an equal patient-practitioner partnership. So we have a moral and ethical imperative to engage patients as equal partners, and not doing slow science and fails us all. When we partner together, we're able to build the right things and build the things right, which leads to better health outcomes for all. Next slide, please. And as Kristen mentioned earlier, The Innovation X methods augment and do not in any way replace the other important roles that parts of the Department of Health and Human Services play. So our methods complement other HHS operating divisions. So NIH still leads on basic research, the CDC still leads on disease surveillance, prevention, and control, and the FDA still leads on safety, efficacy, and regulatory functions. Our team often approaches complex challenges in an orthogonal way so that we complement and do not compete with other groups and conventional methods. Next slide, please. The Office of the Assistant Secretary for Health is working to advance community health and public health infrastructure, serving as the interdisciplinary tissue that aligns diverse sectors together with a shared purpose: health for all, health by all, health in all. And we'd love to have you be involved with the work that we're doing. So if you are a Lyme patient or an advocate, you can follow us on X, formerly Twitter, at Lyme_X. And this is where we share opportunities to be involved, our current initiatives and projects that are open to the public. If you're in diagnostics or an academic or an industry, you can check out our LymeX Diagnostics Prize that Daniel mentioned earlier. And if you're interested in the Vector-Borne Disease National Strategy, you can read the draft strategy, which is available online. And you can also follow us to hear updates on when that final strategy is available as well. Next slide, please. So thank you, and we'll move on to the Q&A discussion.
Fantastic. Thank you all. I really want to thank our presenters, Dr. Honey, Dr. Desautel, and Ms. Carroll. That was fantastic, and it's really great to hear the range and the breadth of all the things that you're doing. I want to just in addition to thanking you, I want to thank our attendees and thank everyone who submitted questions. We did get quite a few. We only have time for a small portion of those questions. And I just want to remind you that what we aren't going to do today is we're not going to answer some basic questions about Lyme disease. I want to refer everyone back to our website, and we can probably put that again in the chat. It's www.lyme.health.harvard.edu. Sorry, lyme.health.harvard.edu, because there's lots of great information there. And if you have questions about Lyme disease in general, I think that's the place to go for them. So let me start. I'm going to ask this question. I'm going to direct it to you, Dr. Honey, and then you can share things around. It was really great. At first, without a doubt, I want to thank you for sharing your own personal story. That is very generous and thoughtful of you to share something that is private. And, you know, this is in many ways, you've created your own public-private partnership here by sharing your story. And these are real stories. And just as you shared that there are many hundreds of interviews and hours of interview, it's very important. And we also have had someone who has really been impacted by Lyme disease, who has worked with us on our Lyme Wellness Initiative. And that's our job. As you just said, it's just absolutely important to bring in real world evidence that is patient generated. And that's really what this whole talk is about the idea of keeping a patient-centered approach to all that we're doing. So with that, it's really great to hear about Innovation X. And I think one of the things that would be very helpful for me to understand, and for I think a number of people asked about it, is how does this project connect with what we think of as, you know, the kind of the halls of government and the wheels of all the regular stuff that the U.S. Department of Health and Human Services do? And you touched on the idea of connecting to NIH or CDC or FDA and scaling what you guys do. Are there, I guess it's a two-part question. One, tell us more about the connection to HHS, and two, are there examples of where you've sort of taken things forward?
Excellent. Thanks for that question. And where we sit is at Health and Human Services headquarters in DC. We're with the Office of the Assistant Secretary for Health. And I think Kathleen said it well as like the interdisciplinary tissue. HHS is a 90,000 person department. It's huge. And within that, there's 12 different divisions that are pretty much their own operating divisions, kind of like their own agencies. So NIH leads on federally funded science, National Institutes of Health, CDC for disease surveillance, control and prevention, FDA for regulatory approvals. There are 12 of those sort of almost autonomous agencies loosely connected. So where we work with them right now for LymeX, probably a good example is a LymeX Diagnostics Prize, where FDA, CDC, and NIH have generously been judges and evaluating some of this in collaboration with partners and external groups. So all of our judges and reviewers are part of a diverse panel. And examples of where the work goes to other places to kind of scale and be institutionalized. With Lyme Innovation, we're relatively new, so we haven't graduated anything yet from this program, but in the COVID diagnostic space, which is an example that our Lyme team is emulating, we did a lot in the COVID response on non-laboratory testing and how do you ingest millions and millions of tests that are happening outside of a doctor's office, in schools, at home, all of that. And our seed work with our Innovation X group became part of NIH with a program called RADx and their MARS program. So it's forever institutionalized between NIH, and then another element of it went over to FDA. And you could Google FDA diagnostics data program, and the FDA and NIH are scaling that program. So we're using that COVID diagnostics as one example to emulate in Lyme.
Fantastic. I think it's great that you brought up the diagnostics. I think that is something that a lot of people are interested in, and we got a number of questions about that. And you touched on the diagnostics in terms of the competition and the great ideas that are coming. A number of people asked about the particularly thorny issue of how do we tell from a new or an acute infection as opposed to a prior either exposure or an infection. Have you seen anything as part of your diagnostics competition, or do you think, if you were to predict, will we see something new in this area of diagnostics?
Yeah, another great question. And I'll kick this to Daniel in a second, but it would be totally revolutionary in the Lyme space if doctors and patients could have a diagnostic test that says this is an ongoing active infection, which would warrant ongoing antibiotics probably, versus this is a, no active infection, but still there are symptoms and how to manage the symptoms. So that does not yet exist. But there are so many emerging technologies. And the other area that I think will be game-changing for Lyme diagnostics is to catch it earlier. So one challenge with Lyme diagnostics, you get a tick bite, it can take weeks, sometimes more than a month, to convert the antibodies. So even if you have a bullseye rash, and not everyone gets a bullseye rash, you could, be definitively positive, have Lyme disease, but it won't show up in the test for many weeks, sometimes months. Some people never seroconvert. So can we close that window and get it at all stages of the disease? So hitting active infection and all stages of disease. And Daniel, I'll turn it over to you to talk about some of the promising technologies that we're incubating.
Thanks, Kristen. So when we were developing the LymeX Diagnostics Prize competition, we really thought long and hard about this concept and this challenge. And what we ended up centering around was we really want to reward a Lyme diagnostic that can detect active infection. So that's what we settled on with this particular prize competition. And so what we mean by that is that if someone were to use a diagnostic that comes out of this program or this competition, you could go into that doctor's office and detect the active infection, meaning that you currently have the Lyme disease causing bacteria in you, and further treatment is needed now to catch that early so that it doesn't become an even bigger problem later on. And so, but the beauty about the prize competition model is that we have 10 great teams that are in this second phase right now, all working on vastly different diagnostics, all trying to get to the same goal. And so they're all, slightly different in their own way and can do slightly different things. And even if a team doesn't end up winning, what we've done with this competition is really spark this innovation, and hopefully they can continue going on with their diagnostic, and we can get multiple diagnostics to market that can do multiple different things. If it's not just active infection, maybe we can get something in the future that can test for, if you've had Lyme disease for 5 years, and we can still test for that. And like Kristen said, hopefully we can get a test that is independent of if you've seroconverted or not, because that doesn't happen for everyone. So that's really the beauty of that competition, I think.
Great. Well, I'm
let me just add one thing. I threw it in the chat, but beyond the 10 teams in the LymeX Diagnostic Prize, we've also been looking at partnerships where we can, where might the department and government be able to apply science that's being done in other sectors for Lyme diagnostics. So there's a couple partnerships we have, one with NASA, which is a great science agency, great innovation tools and best practices, and then also DARPA, the Defense Advanced Research Programs Administration or agency. And they had a program, or have a program called ECHO, which is looking at the expression of people's DNA. So we all have unique DNA, but how it's expressed is impacted by our environment, by the chemicals we're exposed to, by a lot of things. Could it be possible to develop unique fingerprints based on exposure to Lyme disease? It was a hypothesis, and that science is moving forward rapidly. So we're super excited about some of the partnerships, as well as the 10 teams in the Diagnostics Prize.
Great. Thank you both for that update. That's it's very exciting, and I'll look forward to hearing the results of that competition. And as you said, hopefully, even if each individual project doesn't come up with a diagnostic, there's synergy between the projects, and there's something that we gain from all of them together. Dr. Honey, I want to follow up on this idea that you said about unique footprints from people's DNA. It is striking as a clinician to see the amazing breadth of how people present with this disorder and all the different things that can happen to people. And I guess I'm wondering, are there efforts to understand why it is or how it is that Lyme disease impacts people in such different ways?
Yeah, such a complex question. And I'm going to turn over to Kathleen for a little bit to talk about the human design. But I think of the complexity and probably many reasons for it. Our own individual genetics, the different strains of Borrelia. There are different species and strains of this Borrelia bacteria. There are co-infections, other tick-borne illnesses, environmental exposures like mold or other things that may impact the immune system. So there's a million factors, and how we untangle all of that, I think science and data are way out. Science takes a long time. So while the science is advancing, that's where you really want to bring out the lived experience. And if you treat the patient in front of you, no matter what the symptoms, and it's not just that the symptoms can be different in different patients, they can be different in the same patient through time. But if you always treat the person in front of you and what's going on, we can move the needle and make it better, even if it's not a one size fits all for everyone. And with that, I'll turn over to Kathleen to add a little more nuance from all the research she's been doing.
Sure. Thanks, Kristen. Yeah. And I think that, like Kristen said, there are millions of people affected by Lyme disease, and every person's journey is unique. They have a different experience. And the Health Plus Lyme disease report really tried to grasp at this idea of how can we identify the differences and recognize the nuance and the complexity of different people's experiences, and also identify the areas that have the most impact for change. So if we were to make a change in a service or address a certain issue, that would have the largest impact on the largest number of people and improve their outcomes in a specific way. So the Health Plus Lyme disease report features a lot more examples of the impact matrix that I demonstrated earlier, as well as different patient archetypes. So demonstrations of people on different locations on that matrix. So demonstrating the ways that capacity and disruption affect people's lives, as well as recommendations related to improving health outcomes for different patient experiences.
Fantastic. I think we're only going to have time for just one or two more questions. So maybe quickly, one of the things that we always want to do is give people hope. You mentioned this when you were talking about your own story. And if someone who's watching this today sort of says, gosh, I really want to advocate for my own needs or someone that I care for's needs, but they aren't being met, what's the message that you would like to give them?
I would say don't give up, and having a quarterback or someone who will help you manage holistic care, especially if your body or for me, is brain fog, not working well. Having a trusted doctor or colleague who can help you navigate all the different doctors and seeing the holistic big picture and helping you through, I think that's essential. So having a good quarterback doesn't always have to be a medical doctor, but someone who's knows how to navigate the system. And then I think also trusting your own intuition. Like we mentioned, healing is so heterogeneous, so different for so many different manifestations, and we're all unique. So trust your own gut. And if something isn't working or you feel like you're not being listened to, it's okay to turn the page. It's okay to try something different. You have lived in your body for decades longer than anyone else, and you will know that. So I think that taking that individual approach, trusting yourself, and if it's possible to find either a doctor or concierge or someone who will help you keep the whole picture in mind, managing the mental health aspects, the supplements aspects, the diet, it's all levels and all ways of healing. And that can be way too much for a patient, especially when you're not at 100%. So finding that quarterback would be, I think, is one way to try to navigate through the complexity.
Great. Thank you. I want to really thank you all. It's been fascinating and very helpful to hear from all of you. And we have only about one more minute left. And as I thank Dr. Honey and Dr. Desautel, Ms. Carroll, and all of the folks who made this happen on the Harvard Health Publishing side, and with our funders from the Fairbairn Family Foundation, I really just want to say thank you. This is very important and very important, not only to think about innovation for Lyme disease, but to think about how we can involve citizens and patients in the work we're doing. Kristen, I'll give you the last word. What should we look forward to from Innovation X? What's next?
Excellent. Well, I think most have probably heard me say Lyme Innovation's a team sport. So continuing to engage with us, and our office is going to be leaning into Lyme, infection-associated chronic illnesses, and the commonalities between Lyme and ME/CFS, chronic fatigue syndrome, and long COVID, and all these often, chronic, complex, multisystemic inflammatory conditions. What can long COVID teach us? What can Lyme teach long COVID? So infection-associated chronic illnesses is our next frontier. So keep an eye out for how you can engage with us both on Lyme disease and long COVID, and the connection, the intersection between the two with infection-associated chronic illnesses. And thanks for this opportunity.
Thank you. Thank you again. Thank you all three of you for participating in this. I want to thank all of our attendees for joining us. Please go to our website, take a look at our prior 2 webinars. If you missed those, we have lots of great information there. Be well, everyone. Thank you again.